come in?
Hey, Mr. Kyler, how are you doing today?
Good, you?
My name's Tammy. Oh, I'm doing good. My name's Tammy. I'm going to be your nurse today, okay?
Yes, ma'am.
I'm going to be completing an assessment on you, and that basically is just going to be checking out your systems. It won't take more than about 20 minutes, and then I'll get you on your way. Does that work out?
Yes, ma'am.
Okay. I'm going to go get my hands washed real quick, and then I'll be back. Okay. All right, so previous to the video, I took his vital signs, and his vital signs were heart rate 120/80, pulse was 75, his temperature was 98.6, and his pulse ox was 99 on room air. Are you in any pain right now?
No, ma'am.
Okay. And he does not have any pain. The first thing I'm going to do is I'm going to assess your mental status, okay?
Yes,
So
ma'am.
I'm just going to ask you some questions. All right. Can you tell me your name?
Kyler Gaines.
Kyler Gates. Okay. And can you tell me what time it is?
6 o'clock p.m.
Okay. And can you tell me where we are?
Hospital.
Okay. And can you tell me what we're doing?
An assessment.
Awesome. What's your mood today? How are you feeling?
I'm feeling pretty good.
Okay. So he is alert and oriented times 4. His mood is pretty good, and his affect is appropriate. Okay. So now I'm going to get started with your assessment. Okay. I'm just going to touch around on your head. All right.
Okay.
So his head is normal size. It's normal cephalic. His scalp is pink. It's clean and dry. No lesions, no parasites, no lumps, no bumps. Or is any of that hurting?
No, ma'am.
Okay. His hair is brown and straight. Sorry about your hair. The skin on his head and neck is also pink. No lesions, no parasites, no lumps. His eyes are in the top third of his head. His nose is midline, and his mouth is in the lower third of his face. And his ears are symmetrical. His eyes are symmetrical. His eyebrows have hair. They're brown. They're evenly distributed. And his eyelashes are also present, and they're inverted, and they're evenly distributed. Okay? So next thing I'm going to do is I'm going to go ahead and check out your eyes, nose, and mouth. Okay?
Yes, ma'am.
I'm going to use this pen to do it, and I'm just going to shine this light in there. It won't hurt. Shouldn't hurt. It might be a little bright, though. Okay? Just look at me. Okay, so next what I want you to do is I want you to follow the end of my pen with your eyes only, okay? Good job. Good deal. Okay, now follow my pen right here at my shoulder and just stay looking at it, okay? Awesome. So his pupils are equal round and reactive to light, and they are accommodating as well. If I had an ophthalmoscope, what I would look for is for the red eye reflex. His sclera is white, and he does not have any drainage. His conjunctiva is pink. Okay. So also what I could do to test his vision is to use the Snellen chart and have him stand 20 feet away from it, have him cover one eye, assess, cover the other eye, assess, and then assess with both eyes as well. Okay, so I'm going to look in your nose or in your ears right now, okay, with this light. So he does not have any foreign bodies. The color is pink on both sides, no lesions, no parasites. His ears are elastic and they recoil to the original position. Is that anything hurting you?
No, ma'am.
Does this hurt? This?
No.
This. He does not have pain in his auricle, his tragus, or his mastoid process. Stomach's growling. And they are symmetrical on both sides. No drainage. Okay, so I'm going to look in your nose, okay?
Yes, ma'am.
All right, he does not have a deviated septum. His nose is midline with his face. What I'm going to do right now is I'm going to plug each one of your nostrils, okay?
Mhm.
Breathe in for me. Breathe in for me. Okay, his nose is patent and no deviated septum. Open your mouth for me. Say ah. Lift up your tongue. His lips are symmetrical on both sides. They're pink. They're moist. There's no lesions, no cracking. His teeth are white and intact. No caries, no cavities. He has braces. He has no tartar. His gums are pink and no swelling. His soft palate is pink and his uvula is midline, no swelling. Look one more time. Oh, thank you. His tonsils are 2, no swelling, no exudate. His hard palate is white and it has transverse rugae. Can you swallow for me? Does that hurt?
No, ma'am.
Okay. I'm going to check out your lymph nodes real quick. Just going to press on your face, okay? Just tell me if anything hurts. His periauricular, postauricular, tonsillar, submandibular, submental. Does that hurt? Okay. Superficial cervical, deep cervical, and clavicular. All right. Any of that hurt?
No, ma'am.
Okay. And then I'm going to now I'm going to look at his thorax and this. Is it okay if I look down your shirt?
Yes, ma'am. Okay, his skin on his trunk is pink. There's no lesions, no abrasions, no parasites. Right now, what I'm gonna do is I'm gonna palpate your neck. Okay. Yes, ma'am.
Okay, the pulse in his carotid arteries is regular bilaterally. I'm just going to listen real quick. When I do that, will you hold your breath for me?
Sure.
Okay, breathe. Hold your breath. Breathe. He does not have any breweries. Okay, so can you turn your back to the camera?
Yes.
Thank you. I'm just going to listen to your lungs real quick and your heart on the front in a second. When I'm in my stethoscope, will you breathe in for me?
Yes, ma'am.
Okay. Good deal. Thank you. Good. 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 All right, one more big breath. All right, and one more big breath. All right, will you face me?
Yes, ma'am.
I'm just going to take a listen on the front. Okay, so aortic valve, pulmonic, Herb's Point, tricuspid, and apex. All right, I'm going to grab your wrist right here, okay? Okay. His pulse is 75 and it's regular. I'm just going to feel your pulse right here. No bounding, no murmurs. Okay, you still doing okay?
Yes, ma'am.
Alright, will you sit right here? I'm gonna listen to your stomach just a little bit if you'll lean back for me. Alright, rest your head. And he does not have any jugular vein distension at 45 degrees either. Okay, I'm just gonna listen to your tummy real quick, okay?
Yes, ma'am.
Okay. Can you feel around? Does any of that hurt?
No, ma'am.
Okay, you can sit for me. Alright, his abdomen is not rigid, it's soft. His umbilicus, his midline, his stomach is flat. His skin is pink on his stomach, and his bowel sounds are normal active times 4. Also, his spine is midline, and he has an S curve to his spine, and his diameter is 1:2 ratio. His breath sounds, if I didn't mention it before, were anterior, posterior, and lateral vesicular with no adventitious breath sounds. You still doing okay?
Yes, ma'am.
Okay. I'm gonna look at your arms now, okay? And your legs too, for your peripheral. Okay, so the skin on his legs and arms is pink. There's no lesions, no parasites, no rashes. He has hair evenly distributed throughout. I'm gonna feel your radial pulses, okay? His radial pulses are equal and regular bilaterally. Let's see, I'm gonna touch on the back of your legs, okay? His tibial pulses are equal and regular bilaterally. His pedal pulses are equal and regular bilaterally. And his cap refill on his hands and his feet are both less than 3 seconds. Can you do this with your fingers for me? His fingernails are trimmed and clean. That's okay, you can stop. His fingernails are trimmed, clean and translucent. He has less than 160 degree angle and no clubbing present. All right, thank you so much.
Bye.